So core body temperature is the temperature on the inside of the body, and that should be 36 to 37.5 degrees Celsius. That number is decided by the hypothalamus, but it's not set in stone. It takes things into account like time of day, activity, infections, immune status, and adjusts that set point accordingly. Then once the temperature is set, the hypothalamus goes to work to keeping it at that set temperature. One of the ways that the body can fight against changing heat is through thermolysis. Thermolysis means losing heat. Now there's a few ways we can lose heat. We can lose it through radiation, just the heat that we naturally give off. We can lose it through conduction, when we touch something cold. Convection, when air moves across us, or through evaporation, when water turns into a gas and heat is released. So our body can increase and decrease all of these things to help control how much heat we lose. So here's a quick experiment. Go get 2 bowls of water, one with hot water, one with cold. Put your hands in each. What happens to the veins in the warm water? They get bigger. Why? Because your skin is too warm and the blood vessels dilate to get the blood close to the skin to try and release some of that heat. What's going on in the second bowl? The skin should be really pale. Why? The vessels have constricted. The blood's getting pulled back to the warmer parts of your body to try and stop the heat loss. That's why when we get real cold, we'll start to turn white and even blue. This can be really serious and lead to things like frostbite, as tissues start to get damaged due to lack of blood flow. Hunting's response is a periodic dilation of blood vessels that the body can use to help preserve cold tissues. We'll talk more about that when we get to cold injuries. Let's move on to some more thermolysis. Sweating. That gross thing that happens when we get stressed, exercise, or when we're outside on a summer day. What's the common denominator? Our body gets hot. Sweat is released by sweat glands in the skin, and the key purpose of sweat is to help us cool down. It does this by covering our skin in water, which promotes convection and evaporation. This is an important concept to remember when we're treating patients with hot and cold injuries. If they're too cold, make sure you dry them off, as that water is going to pull away a lot of heat. And if they're too warm, try some water and cool air that's blowing past them, like a fan or the AC in the ambulance. It'll cool them down real fast, but be careful not to overdo it. One last quick point before we wrap up this lesson. Why is it that some people have to bundle up to go outside on a winter's day, while other people can walk around with a hoodie? Well, there's a whole bunch of biological factors that go into that answer. It might be their compensating methods. That is, their ability to remove or generate heat is just more efficient. Maybe it's psychological, or maybe they just enjoy the cold. Or maybe they're just used to it. Acclimatization is when you have a repeat exposure to a stimulus, and you begin to have physiological changes or adaptations that adjust to that. It's like how people who live at high altitudes can function way better than those who are just visiting, or how regular swimmers can hold their breath longer than people who don't. In terms of hot and cold environments, it takes about 7 to 14 days to acclimatize to new temperatures. For people in a hot environment, you'll begin to notice that you'll begin sweating a little bit earlier and at lower temperatures to keep your body in a more comfortable range. Your plasma volume will increase, and when you do sweat, you'll lose fewer electrolytes, so there'll be less salt in your sweat. Your heart rate will typically decrease, but the stroke volume will increase. And finally, you'll have increased aldosterone that's released earlier, so you'll lose about 20 to 50% less sodium. For those of us who are chronically exposed to cold environments, there are some physiologic adaptations as well. Cold habituation can occur, which is a delay in the shivering and vasoconstriction response. This is thought to be due to a decrease in norepi being produced, but it's commonly seen in people like fishermen who dunk their hands in cold water repeatedly. There's also metabolic acclimation. People in chronic cold environments typically have higher BMRs, which helps keep their skin temperature warmer in cold environments. This also means that typically they have more brown fat deposits in their body, as the brown fat is often used for the fuel for non-shivering thermogenesis. Lastly, people can develop insulative acclimatization, where they have an improved ability to circulate blood to muscle groups and other warm structures, keeping their core body temperature warmer longer.